Hello, everybody. My name's Simon Barry. I'm a respiratory consultant in Cardiff in Wales, and I'm the lead for the Respiratory Health Implementation Group. So I'm going to tell you about what we did in COVID, particularly focusing on the COVID recovery app. Could I have the first slide, please? Okay, so co-production during COVID, what can we learn from the All Wales COVID recovery app? Next slide, please. So basically in Wales, we think we had a national coordinated response to COVID, and this is a document which is 200 pages, which focuses on all of the things that we created in primary care, secondary care, and for patients. Next slide, please. So I'm just going to focus on a little bit of context before I go into the COVID recovery app, because I think it's important to set the scene. Well, I always thought or saw COVID as a war zone, not because people were dying, they did obviously die, but because of the level of confusion. And the confusion here was because this was a new disease and we really didn't know what we were doing. There were no guidelines, there was very little evidence. And if you don't have guidelines and you don't have evidence, then people do wildly different things. So you get a lot of variation. And, you know, all that we had was coming out from Wuhan, published in the Lancet New England Journal on some data about, you know, people who were older and frailer with comorbidities were getting sicker, but that was about it. So we knew that new evidence would come up very rapidly, and the question was how were we going to be able to inform healthcare professionals to try and standardise care. There's huge pressures on the NHS to adapt, and the NHS is not an adaptive organisation, but it did adapt, and the remarkable rapid procurement of PPE and the creation of field hospitals is an example thereof. Next slide, please. So this is just an overview of what we did creating COVID. So you can see that we created innovations for primary care, secondary care, and patients. And it's the patient-facing thing that I'm going to really focus on, but just the context here. So we created a primary care acute COVID guideline that actually didn't come in the first wave. That was a bit later on, and this was really about, you know, who is it you need to admit to hospital, and just triaging from the primary care perspective. These guidelines are associated with TV shows with experts delivering short video-based updates. On the right of that is the secondary care hospital guideline that was created in March 2020 within 2 weeks from scratch, and quite a sophisticated guideline with QR readers linking to videos which were updated as new emerging evidence came around. And then the patients, this is all acute COVID on the top row, and this was the patient-facing app, which not only dealt with the long COVID features, but also enabled patients to understand when it was that they needed to see their healthcare professional. They could record their oxygen saturations and so on and so forth. And then on the bottom row is for long COVID or persistent COVID symptoms. So we created a primary care framework, and really what this was about, this is really what I'm going to be talking about, was we surmised that actually patients with post-COVID syndrome would have a lot of problems, which would be physical and psychological. And a minority of them would end up actually having evidence of single organ dysfunction. So we created a guideline where we tried to help GPs triage patients that had evidence of organ dysfunction, whether it's cardiac or neurological or respiratory, and there were various tests that they could do. And if they thought that they had organ dysfunction, they referred them to a specialist clinic. And if that wasn't the case, then they were referred to a multidisciplinary team, which was built up in every health board, and that those team would pick them up and help them through their recovery process. There was nothing specifically in secondary care for this, but the COVID recovery app was the other thing. So this is the bit I'm really going to focus on, focusing on helping patients get better from their COVID. Next slide, please. So this is the hospital guideline, a little bit more detail, and you can see it had a fixed component here, which was flow through the system, and then you're either discharged or you're basically you were discharged or you died essentially. And these are the various places where you could be managed, whether it's intensive care or the ward. And this is the management for oxygen. You can see it's quite simple, easily laid out, and there's QR readers. Next slide, please. And these hospital guidelines, the little graph at the bottom shows the brown bit is the hospital patients with COVID, and the green graph shows the number of new registrations into the platform. So in order to access the guidelines, you had to be signed into the platform. And then you would get emails showing with updates. Now, this is a new way of delivering a guideline that I'm not aware has been done before, because actually if you publish a guideline on a website or in a paper format, you have no idea what proportion of the target audience has even read it. But actually, because this was a system people signed into, we knew how many times each user had been in, how long they'd spent in the guideline, what they'd looked at. And so we published a paper recently, it's in press actually, showing that this was a new way of delivering guidelines, which enabled you to understand what proportion of the target audience had actually read it. Next slide, please. We created our COVID data collection tool for all hospitals, and we collate and retrospectively data was inputted, and then we had an indication on a national basis or from different health boards about what was happening to patients, how many were dying, how many were discharged, and a whole host of other information. Next slide, please. And the paper came out of that, which was about looking at all hospitals. So all of this stuff was done nationally across every hospital in Wales. And we looked at all the data, and we published a paper on nosocomial mortality, which was higher than patients being admitted with community-acquired COVID, as one might expect, because patients in hospital tend to be older and frailer. Next slide, please. So this is so I get on now to the COVID recovery aspect. So as I said, this was really an attempt to create a strategic approach to managing COVID, which wasn't just let's just refer everyone to secondary care, because let's be honest, at that stage no one was an expert in COVID. No one really knew very much about it at all, and we surmised that this would be similar to a post-viral condition that had happened in previous examples, and that most people would really need a multidisciplinary team approach to get over their deconditioning, their mental health problems, and so on and so forth, and a minority would end up requiring specialist input. So that's what we strategically built, and part of that was the patient-facing interface. Next slide, please. So the COVID recovery app, we decided that we needed to do this. We first of all decided that we wanted the COVID recovery framework, and then we thought we really need to be creating something for patients. So we decided to do this very quickly, and we built it very quickly, and it was launched in December 2020. It's like all of our apps, we've got a number of other apps for patients, including for asthma and COPD and pediatric asthma. They're bilingual, they're free. They're built by healthcare professionals for patients in Wales. They're part of a whole implementation framework, so they don't exist on their own. So they're aligned to the other guidelines. And in this case, we got the long COVID group involved in the guideline, and they actually updated the app to introduce new features, including new symptoms and so on. And this was independently reviewed by Orca and given really quite a good score. Next slide, please. So this is data on the downloads. So you can see the dates go from December 2020 to June 2022, and essentially you can see the trajectory remains remarkably similar. There was initial upsplurge, but then it's remained pretty stable, and there's about still 25 downloads per day in Wales. and we got more than 12,000 downloads, which, according to ONS data, if you take their model on sort of 1 in 20 people having long COVID symptoms, then that should be most of the patients in Wales. Well, certainly a large proportion of them. Next slide, please. So what about the data? So we've got data from it, and we've done 2 data trawls, each resulting in 500 patient responses. So the age distribution is, first of all, it's more females, 70% females and 30% males, and mainly middle-aged group, 35 to 44 and 45 to 54, with some outliers in either younger and older. Next slide, please. These are the health boards. There's 7 different health boards in Wales, and Powys actually is a very large health board with a very small population. So I think they're pretty well covered. Betsy Cadwallader has the largest population and the most downloads, but the others are fairly similar. And you can see that about 7% of users are actually from outside of Wales. Next slide, please. So this is, in this survey, we asked the patients who downloaded the app what their symptoms were. Moderate symptoms were defined as feeling unwell, very unwell, and short of breath, but not requiring hospital admission. Severe symptoms were patients who did require hospital admission. And you can see that 60% of patients weren't hospitalized, but did feel that they had severe symptoms. Next slide, please. We asked about symptoms, and here's a range of different symptoms. In fact, there's a huge number of different symptoms, but you can see that the majority of the symptoms included fatigue, breathlessness, deconditioning, brain fog, aches and pains, and so on. Next slide, please. So in the survey in 2022, the second survey, we asked patients whether their symptoms had improved, and you can see that about 24% or so they've improved a lot, and about 37% have improved a little. So, you know, overall, nearly 60% have shown some improvement, and about 15% said their symptoms have got worse. Next slide, please. We encourage patients to or users to download information on their activities, and these are the most common that were recorded. These are fairly low level of activities: walking, meditation, yoga, chores, and reading. But there were some who were functioning at a sort of higher level and mentioned more extreme physical activities, including running and aerobics. Next slide, please. So I think the most interesting part of this data is about what patients' expectations were of how they would get better. So when patients signed up to the app, they were asked to fill in this survey about how quickly they would expect it to recover. And you can see that nearly half of patients expected to recover in 1 to 3 months. And then another quarter expected to recover in 3 to 6 months. About 14% in 6 to 12 months, and 8% expected to recover in more than 12 months. So the expectations, this is important. The majority of people really did expect to recover, and a small proportion, less than 10%, thought their symptoms would go on for more than a year. Next slide, please. And this is a bit busy, but essentially this shows what happened to the patients based on their initial expectation as to where they were in their journey of recovery. So here we've got, this is 12 months or more, expectation of recovery. This is 1 to 3 months, and you can see here if you're 1 to 3 months, you know, about 15% have already recovered. Another 10% or so think they're going to recover in a few months. A large proportion don't know, and a very small number think they won't recover. If you look at the 12-month group, you've got a lot of them say they don't know. A much larger proportion think they'll never recover, and a relatively large portion think it'll take them at least a year to recover. So the data suggests here that the patients who thought they would take longer than 12 months to recover didn't get better. And that really was replicated on a second survey as well, the same sort of findings really. Never recover, was a very small number of the 1 to 3 months, but much larger number of the ones who thought that they were going to take longer to recover. That to me is the main sort of interesting findings of the app, what patients felt about their expectations. Next slide, please. Okay, so that's the app. And then within the app, we asked whether patients had seen a healthcare professional and whether they find that beneficial. So most of the time, what this is referring to whether they'd seen been involved in one of the multidisciplinary teams. And you can see there's a bit of variation in the different health boards, but around about a third found it useful, a third didn't find it particularly useful, and then there's no response in the others. And maybe there's a little bit of improvement in the later survey, with responses going up to sort of around 40% for they found it beneficial. And you got to remember that those services were being set up initially, so they didn't exist in a very well developed form at the beginning. Next slide, please. So I'm going to end here and just summarize these findings. So basically, overall in Wales, we developed a strategic approach to COVID, and that related to acute guidelines in primary care, acute guidelines in secondary care, and patient-facing interface, and also for long COVID as well. And you know, I think the COVID recovery app has been remarkably successful in terms of its downloads. It's just running itself. We're not actively promoting it. It's just it's there and people are using it. And I think this data says something really quite interesting about what patients expected and what the actual outcomes have been. So it actually helps us inform the sort of services that we can deliver. And I'll stop there.